Hello and welcome to MedMic. My name is Banele Manana, and in this video we will be shedding some light on bacterial meningitis. We will be looking at a case study that was conducted in 1986 in the United States of America, where several cases of bacterial meningitis were reported in several states. Now, when we look at a disease such as bacterial meningitis, we want to ask ourselves three things. Where does it come from? How do you know you have it? And how do you get rid of it? Which then begs the question, where does bacterial meningitis come from? My team and I will be answering this by looking at incidence occurrence, its etiology, reservoirs, as well as virulence factors.
In 1986, a surveillance study on bacterial meningitis was conducted in the United States on a population of 34 million people. Of the 5 bacterial pathogens studied, 90% of the cases was caused by Haemophilus influenza, meningococcal, and streptococcus, while group B streptococcus was the lowest case but more common in the elderly. The Haemophilus disease manifested into meningitis during infancy and childhood. During the ages 6 to 9 months, the rates of meningitis decreased. In children younger than 5, 95% of meningitis was caused by group B streptococcus, while in adults older than 30, it only caused 70% of meningitis. The rates of meningitis decreased between the ages of 5 and 19. Reported fatalities caused by pneumonal meningitis was higher in adults than in children. Pneumonal meningitis was more frequent during winter, while other organisms showed no seasonality.
Etiology refers to the manner of causation of a disease or condition. Bacterial meningitis stems from the inflammation of the membrane surrounding the brain and the spinal cord. Bacterial meningitis specifically is a very serious condition and can be fatal within days without antibiotic treatment. Bacterial meningitis occurs when the bacteria enters the bloodstream and travels to the brain and spinal cord, causing acute bacterial meningitis. However, it can also be caused when the bacteria directly invades the meninges. This can be caused by ear or sinus infections, a skull fracture, or, although very rare, after some surgeries. Several strains of bacteria can cause bacterial meningitis. Most commonly, Streptococcus pneumoniae, Bacterial meningitis, and Listeria monocytogenes. Skipping vaccinations is not recommended as it increases the risk of contracting the condition, especially for anyone who has not completed the recommended vaccination schedule. Age is another risk factor. Bacterial meningitis is most common in those under the age of 20. Since the bacteria travels through the respiratory route, living in community settings is another major risk factor, as bacteria spreads quickly through large groups. One of the major risk factors for contracting acute bacterial meningitis is a compromised immune system. AIDS, alcoholism, diabetes, and the use of immunosuppressant drugs and other factors that affect your immune system also make you susceptible to contracting the condition.
Reservoirs of an infection is any person, animal, plant, or substance in which an infectious agent can live and multiply. Reservoirs typically harbors the infectious agent without causing any harm to itself and serves as a source from which individuals can be infected. Several different bacteria can cause meningitis. Neisseria meningitis is one of the most important because of its potential to cause epidemics.
Bacterial meningitis is the most serious as it can cause severe disease that can result in brain damage and even death. Most commonly caused by one of 3 types of bacteria: meningococcal meningitis, streptococcus pneumonia, and Haemophilus influenza type B.
Transmission from person to person through droplets of respiratory or throat secretions. Close and prolonged contact can facilitate the spread of the disease. Neisseria meningitis can only infect humans. There is no animal reservoir.
Virulence factors are the properties that allow a microorganism to attach itself on or within a host of a certain species and increase its potential to cause a disease. Meningococci are carried asymptomatically into the nasopharyngeal. Virulent invasive forms of the bacteria may overcome host defenses and adhere itself to the epithelial cells. Mucosal invasion and transcytosis allows bacteria into the bloodstream. The polysaccharide capsules are a major virulence factor, allowing organisms to resist classical complement bactericidal activity and neutrophil phagocytosis. Several virulence factors, including internalins and pore-forming toxins, activate host signal transduction and mediate gene activation, causing an inflammatory response.
Now that we know where meningitis comes from and what it looks like, let us take a look at how you know that you have it. We will be answering this by showing you clinical features and how it is diagnosed. But first, let us look at the socioeconomic implications.
The socioeconomic implications of the disease are serious. Control and prevention requires a considerable amount of vaccines, medication, and logistical support from the national health authorities of the affected countries. Most countries struggle in responding appropriately to these needs, leaving disrupted health routines and other important activities. There are factors to a higher incidence of the disease, which include poor living and overcrowded housing. The impact of the disease is greatest among the underprivileged population. Large population movements such as pilgrimages play a major role in the spread of the infection. Travel and migrate also facilitates. Population displacement such as those of refugees may pose a similar risk on the circulation of the pathogenic strains inside a country or from country to country.
In the beginning, clinical features of bacterial meningitis are non-specific. This includes common symptoms like fever, headache, and malaise. Later on, meningismus or neck stiffness, photophobia, phonophobia, and vomiting may develop as signs of meningeal irritation. Headache and neck stiffness indicate inflammatory activation of the meningeal and trigeminal nerve fibers. In the early stages of the disease, meningismus might be absent in comatose patients, in children, and in immunosuppressed patients. Although classical clinical features, the triad of headache, fever, and delirium is only present in 50% of cases with known bacterial meningitis. Approximately 33% of passengers present with epileptic seizures. Up to 69% of patients present with paralysis of a limb, and 14% of them may go into a comatose state. Meningitis can be confused with meningococcal disease. Meningococcal disease presents with cardiovascular insufficiency. This symptom allows for differential diagnosis.
Medical diagnosis refers to the process of determining which disease or condition determines a person's signs or symptoms. A case of meningitis was defined as a clinical symptom in which a bacterial sample is accompanied in a cerebrospinal fluid sample. The cerebrospinal fluid sample is retrieved through a spinal tap in which a needle is placed into the person's spine in order to collect cerebrospinal fluid around the brain and spinal cord. It is the only test that truly confirms meningitis, and confirms it when cerebrospinal fluid has high levels of white blood cells as well as proteins, low glucose concentrations, and heightened antibodies responding to infections.
By now you should have an idea of what bacterial meningitis looks like and how it is diagnosed. But let us take a second to look at how it is treated and how to prevent infection.
The general treatment to ease meningitis symptoms are through lots of rest, over-the-counter medication, as well as lots of fluids which are water, to replace the fluids that have been lost through high temperature, vomiting, and loss of appetite. If the bacteria is acute, doctors will administer corticosteroids which will prevent later complications such as brain swelling and seizures. However, if the bacteria is more severe, doctors will then administer intravenous antibiotics. If these intravenous antibiotics do not work, vancomycin will then be administered.
However, vancomycin on its own is not effective. Therefore, doctors will administer a combination therapy, which is intrathecal therapy along with vancomycin, which produces favorable results. Treatment for meningitis may or may not lead to a full recovery. However, the earlier treatment is initiated, the better.
The best way to prevent bacterial meningitis is by treating the infection before the disease occurs, and this is best done through vaccinations. Vaccines prepare the immune system by exposing the germ to the body so that the body is better able to fight it when the disease occurs. They are proven to be extremely safe as they are composed of purified polysaccharides and proteins. If you have been in close contact with somebody who has previously had bacterial meningitis, preventative antibiotics are offered, which reduces but does not eliminate the risk of catching the disease. Generally, a good way to ensure the prevention of this disease is by practicing a healthy lifestyle as well as good hygiene. It's important to wash your hands regularly and not to share foods or drinks or anything which may act as a vector for the disease.
Hopefully, you now have a stronger grasp on what bacterial meningitis is and how it is treated. Please refer to the link down below for all our sources. Thank you for watching our video. My name is Banele Manana and this has been MedMic.